In this next video, we're going to take a look at what a stroke actually is and what are the causes of some of the strokes that you'll see in patients in clinical practice. Strokes are predominantly caused by either lack of oxygen due to a blockage or by pressure by bleeding, and in this video we're going to take a look at both ischemic and hemorrhagic strokes in detail. So what exactly is a stroke? First of all, a stroke is a focal neurological deficit, and by this what we mean is that the patient will have a deficit of either motor or sensory. But as you know, this can affect the speech in terms of motor, the facial muscles in terms of a facial droop or weakness, and also the arms or legs in the motor cortex. But also it can be sensory as well, and you might have patients who have a balance defect due to proprioception problems, the senses. You might also have a patient who has a sensory deficit in their face, arms, or extremities of their body. And these are what we mean by a focal neurological deficit. The timing of a stroke is also important, and it'll always be rapid, and that's an important point for the history that we have to distinguish with the patient, if the symptoms happen quickly or if it was a gradual onset. If it's gradual, we can usually think that this might be a chronic condition or something else other than a stroke. For example, a lesion within the brain, a metabolic issue, or sometimes maybe even a cancer. It's an important fact to distinguish with the patient or with the relative that if these symptoms happen quickly or slowly. And strokes are always due to a vascular cause. And we can split these up into two easy categories, an ischemic stroke or a hemorrhagic stroke. So what is an ischemic stroke? An ischemic stroke is by far the most common that you will encounter in clinical practice. And generally about 85% of strokes are caused by ischemia. Ischemia, as we know, is a lack of oxygen. And within an ischemic stroke, these are typically caused by an occlusion from multiple sources. The first one is an embolism, and this is generally formed somewhere else in the body, and this could be either air or it can be a clot. This will form somewhere else in the body, such as in the limbs, as in a DVT, or in the arms, and this will then travel from that area to the brain, cause an occlusion, and therefore a lack of oxygen and a stroke. The next is a thrombus, and these are normally locally formed, and these are a plaque rupture caused by atherosclerosis, and as a cause of this is vascular disease. So these are small plaque ruptures that happen and then block the vessel off, causing a stroke, a lack of oxygen. The next thing is hypoperfusion, and this is reduced perfusion, which can be caused by somebody, for example, in cardiac arrest, where there's hypoperfusion leading to ischemic damage of the brain tissue. So even your patients with cardiac arrest can have stroke during resuscitation. And the final one is a cerebral venous sinus thrombus. This sounds complicated, but essentially what this is blood stagnation, and it will be venous congestion, which then causes a thrombus and a clot to form. Often you see patients who have a stroke have atrial fibrillation, and this is relating to an embolism, which is caused by venous congestion within the heart, normally within the left atrium. This then breaks off, travels up through the carotids into the brain, and then causes a stroke. The final type of stroke makes up the next 15% of strokes that you're likely to see in clinical practice, and this is hemorrhagic. This is caused by either bleeding or trauma, and these patients have the highest likelihood not to make it into the hospital, with around 1 in 10 dying in the back of their ambulance before actually reaching the emergency department. We can classify these into two things. The first is intracerebral, and this is normally second to a ruptured blood vessel. These can be either intraparenchymal, which is inside the tissues of the brain, or intraventricular, inside the ventricles of the brain. What happens with these is that as the blood vessel ruptures, hemorrhage and the subsequent clots are formed, and this causes pressure on the remaining tissues, leading to ischemia, and then ultimately to reduced brain function and the signs and symptoms of a stroke. The next one is subarachnoid, and this is bleeding on the outside layers of the brain, the pia mater and the arachnoid mater. These are typically seen in the elderly patients who have a trauma, a fall, and are on anticoagulant or antiplatelet therapies, and unfortunately that increases their bleeding risk and therefore their likeliness to have a hemorrhagic stroke. Both ischemic and hemorrhagic present with the same signs and symptoms and can be identified using the FAST test. However, the causes and treatments, as you will see in the course of this presentation, are very different.